Back with you here on the Newsfeed PM. 3 nurses at the hospital in Whittlesea in the Eastern Cape are on suspension. This comes after a video of a naked female patient circulated on social media. I'm joined now by Vuyo Nodlau, Eastern Cape Denosa chairperson. Vuyo, good to have you. Thank you very much for your time. What do you make of the events that would have led to the video that we've seen circulating on social media, and therefore the outcome that the hospital would have then pursued?
Greetings. Thank you, Thabo, for inviting us. Indeed, as the provincial leadership, we have come across to the report that confirmed there's a precautionary suspension that has been held to 3 healthcare workers at Hewu Hospital after the circulation of this video on social media that took place and the public by the straw. But what we make a sense of it, that is the fact that we are glad that a disciplinary process the department has indicated, so that we can find to this finality as to what has transpired, to this incident. It is a normal process, otherwise, that we understand that the employer has to investigate the matter of any misconduct against any employee that would institute the process of disciplinary hearing. So to allow the investigation so that it can continue without interference. So therefore, what has come to our attention was that all those processes have been kickstarted, but however, it came as a surprise to us as to this conduct that has taken place in the hospital.
What has come to light to you about the events that would have led to that conduct? Because residents are saying here the patient was not helped. The patient instead was filmed naked. There was no referral letter. There was just nothing really that was taken into consideration in terms of processes and procedures in health institutions that could have been followed, particularly by nurses.
At this point in time, we are still also following up our investigation. Also, we are so anticipating, waiting for the proper investigation of the department. But what we had outlined, we cannot perhaps say that the patient was not in a healthcare institution. So, but also at us, where we are standing at this point in time, is just that we want to check what are the exact issues that have happened. But as an organization, we want to say, at least clearly, and come up that we are clear of the fact that our core business is delivery of healthcare services, and in a manner that satisfies our patients and the public. Although we know the environment under which we deliver these services, how it should be, but at the core and the business of that is just that the investigation, what we anticipate is just that it has to come up with the facts and also the specific as to what transpired, and then so that any necessary action should be taken, whether it should be the department or others. But we can't confirm as what has been said on the social media, because we are still at the core of the investigation, also ourselves, also awaiting the report of the department so that we can maybe put all these effects into place.
You've highlighted and brought to fore, of course, the issue that has also been raised by the residents, the poor condition of the hospital, the leaking roofs, the broken toilets, which they mention here. Do you think this it could be a contributory factor to the behavior of the staff at that institution?
I think, as we have highlighted so many issues, is that our province has been lagging behind in terms of poor infrastructure, especially in our institutions. And also, we are also in the process of really coming out with a department to say what are the plans so that we can say. So there are a number of factors that would be contributory factors, except of the poor infrastructure, because the first conduct is just that patient care is our key business of the day. So we look at those factors. What are other factors that would have maybe perhaps called to that if there was an element of neglect on our side, if there was an element of the department shortfall on the side. So there are a number of various factors that contribute to that. But what we can say is just that we indeed are at the loggerheads with them to say there is a need that we need to push those standards. We need to push all the comprehensive plan of the department to say that even those who are working in these conditions, we improve the conditions, and those who receive the service they receive a quality healthcare service. So we are at that. So we can't identify as to what kind of an element, but all those elements, what you have mentioned, are also some of the contributing factors we can say they might, put a specifics on that.
Now, of course, you're saying that video material is also still being thoroughly investigated, but there are reports indicating, for example, that there could be voices there talking in the background, one saying that the patient is gasping for air, another one saying that it was God's grace that she was found still alive. What would have been the outcome? What happened to that patient? Did she demise from the illness, or was she... there was the intervention to help her recuperate?
Although I haven't examined the video myself, but what I've gathered, we have gathered during the investigation and our deliberation with the hospital concerned was that I think the patient was within a healthcare facility. It depends on the extent of the injuries that the patients were there. But we of the belief that whatever the investigation will come, it will give us to the conclusion to say exactly what transpired. But we believe that it can be, a situation whereby not. But from what we have extracted, we are still not getting all the facts and that what are the videos, what was said behind the video, so that we can make a confirmation of that. But we can confirm and say that. But what we understand, it was in a hospital setting and there was processes that have taken care. The situation where at what extent was, the assessment or patient care, we are not sure of that. We are also hoping for that investigation to give us clear details.
But did the patient die on that same day?
The report said the patient did demise, but as I'm saying, it's just a report that got there. So the formal report we said, and also what were the reasons for the demise of the patient, because I believe the patient got there because of what a medical, situation to be attended. So after all the report has thoroughly went through those, it will give us a clear indication as to say what was the actual cause of the demise. But I can confirm that we did indicate that.
All right. The residents are calling for the nurses to be fired. Do you think it's premature to make that call?
Indeed, in any situation where you find that there's, a media coverage that is giving a picture of what has transpired, the public reserve the right to be angry until they get, the whole story and the department analyze it. So it's a normal situation in any circumstances that where you feel that you have not been, given the ultimate or the multiple healthcare that you are supposed to be given, then you might have that. So the residents are at their right because that is what has been portrayed. But what the investigation we hope it will do, it will get to all the facts and the steps to say what actually has transpired so that the necessary actions and the department, what it needs to do on their side and what, the employees need to have done on their side, it will be put into test or out in the open so that we can maybe then therefore justify all those actions. But indeed, like any other, public, whenever there's something of that nature, there would be a public outcry. We do understand that.
Rio Nodla, we appreciate your time. Thanks so much for coming on.